Welcome back. Today we are talking with Dr. Kyle Arthur from CoxHealth. Thank you for coming in. Great to see you.
Good to see you.
What do you do at CoxHealth?
So I'm primary care sports medicine. We were having that conversation earlier about what is a primary care sports medicine doctor, and it's kind of that bridge between a primary care physician, who you might call your family physician or your general practitioner, and an orthopedic surgeon. And that's sometimes confused, and a lot of times patients ask me that same question of, are you going to be my surgeon, or who do I need to see? And so primary care sports medicine does basic family medicine training and then goes on to do a fellowship with musculoskeletal injuries. So I have the background in kind of a broad scope of medicine, but I've chosen to focus my practice on musculoskeletal injuries like bones, tendons, muscles, stuff like that.
Speaking of bones,
yeah,
you know, you have a walk-in clinic now, and how do you know when you're aching and something's wrong, when you need surgery, or when you need to come to the walk-in clinic?
So a great place to start is the walk-in clinic, and we use that to try to let people get a little bit more focused treatment rather than going to the ER, where a lot of times the ER physicians do a great job, but they don't have that same training and focus in musculoskeletal care. So they can say, you need to follow up with an orthopedic surgeon, whereas you come in to see us as primary care sports medicine doctors, we can make the decision of saying, hey, you have the option of surgery, or we can try non-surgical stuff, which is what I do. And that can involve splinting, casting, if it's a broken bone. Oftentimes we partner up with our physical therapists immediately next door and use physical therapy to help recover an athlete or non-athlete back to doing what they want to do.
Right. What are some things you see besides broken bones? What are some common things that people run into?
Broken bones are kind of the bread and butter, but we also see just regular old sprains and tendon injuries. And the difference between a sprain and a sprain would be involving the ligaments around a joint, and so you can see an ankle sprain, where a strain, usually we call that tendinous injuries, and the tendons are what connect the muscles to the bones and help you get power to move your joints.
If you've broken a bone,
yes.
Now I've heard this. Is this an old wives' tale that a sprain sometimes hurts worse than a break? And do you know, if you know you broke a bone, do you know you broke a bone?
Sometimes, and that's really hard to tell sometimes, especially with different age groups and different kind of injuries. One question I get a lot is, what's the difference between a fracture and a break? And really to us it's the same thing. But a broken bone can be very not obvious sometimes, and so it's okay to question it and come in and talk to a specialist like myself, and we have the option of doing x-rays immediately. We've got other cool stuff that we can do. We can get imaging studies with ultrasound, with MRIs, with CT scans, or just a plain old x-ray, and a lot of times the x-ray will just tell us which direction we need to go with an injury.
Dr. Arthur, sometimes, you know, as we get a little older, you're just walking or you're stepping and you feel something. What is going on? What can we do to prevent that?
Being as active as you can.
Yeah.
That's one of the best things for bone health, is continuing to exercise and put stress on the skeleton. You see that a lot with our astronauts in NASA. They have to exercise in space because there's no load on their skeletal system and their bones begin to atrophy. The skeleton and bones, I think it's awesome. I'm a bone guy.
Right.
And so I think it's super cool how the body uses stress to tell our bones and skeleton where you need to reinforce. And one of the drives for healthy bones is exercise. Also super important to drink plenty of milk to get a good source of calcium. And also we know the importance of vitamin D, which is you get from natural sun exposure. Right. And so vitamin D in combination with calcium, in combination with maintaining a healthy lifestyle, not smoking, if you're diabetic, controlling your sugars, all those things are super important for general bone health.
Right. Dr. Arthur, if somebody's not familiar about the walk-in clinic, where is it and what are the hours and who can come in?
Right. It's something we've just expanded. We used to have a sports medicine clinic dedicated for athletes. Now we've expanded our hours and what we see. We are open from 9 a.m. until 5:30 p.m. and we're at the Bone and Joint Center on South National. That's 3555 South National, just north of the big hospital. And so we're trying to put up as much signs and let people know where we are, but if it's any kind of musculoskeletal injury to the joints, to the limbs, if you're not sure if it's broken or if you're not sure if it's just a sprain or a strain, come in. We can help you figure it out, and we can usually point you in the right direction.
Very good. Thank you, Dr.
so much,
Arthur.
Doctor.
We appreciate it.
Thank you. Yes, so good to talk with you. Very informative, too.
It is.
I like learning that. All right.